So good day, my dear postgraduate students. Welcome to Glide the Slide 80. In the last class, I had given you a slide with a history of a 2-year-old child coming with abdominomegaly. You were asked to identify the lesion, describe it, or even write a short note on. This has been uploaded by R.A.T.S, and I would like you people to kindly pick up this reference for a wonderful study. The diagnosis is hepatoplastoma. An introduction. It occurs in children less than 2 years of age. Most of the blastomal tumors occur at young age. We must remember that. And with the advent of neoadjuvant chemotherapy as well as surgery, the prognosis has turned out to be excellent in this case, which is otherwise aggressive. And the prognosis also depends on the alpha fetoprotein 11. It forms about 1% of all pediatric tumors. And there are two components of it, the epithelial and the mesenchymal. Sometimes it can be mixed. Etiology. It is sporadic, but it can be acquainted with familial polyposis of Beckwith and Weidman. Edward trisomy has been positive in quite a good number of cases. Also, whenever there is one blastomal tumor, there is a chance of something else also being there. In this case, nephroblastoma, which also is associated with Beckwith-Weidman. Tobacco smoking during pregnancy of the mother. Minute signaling can lead to increased amount of beta-catenin protection. And there is also a human telomerase reverse activity. Mixed signaling is reduced. So these can be the various etiological factors. You people can enumerate a few for the exam. It arises from the primitive hepatic stem cells. The types can be EHP, embryonal hepatic blastema, or it can be a mixture of EHP and the mixed epithelial and mesenchymal type. There are various microscopic types called the embryonal, fetal, pleomorphic, macrotrabecular, small undifferentiated, and cholangioblastic. These are all variants of the histopathology. Basically, it is composed of basophilic, small, undifferentiated cells with scanty cytoplasm. Mitosis is increased, therefore the tumor appears aggressive. The tumor can be seen in the form of nests, trabeculae, acini, pseudorosettes, or in sheets. Macrotrabecular, more than 10 cells thick. 1 or 2 cells thick is supposed to be a sinusoidal pattern. 3 or 4 is trabecular pattern. And nearly 10 is macrotrabecular. And it is dyscohesive. Sometimes there can be a teratogenicity also involved. In the fetal, it is mitotically active, whereas there can be the other forms such as pleomorphic, poorly differentiated, and anaplastic. Look at this, for example. I am able to see poorly differentiated cells. Mainly, the cells are small, fairly uniform. They are having a basophilic cytoplasm, and the nucleus itself is quite small. There can be increased amount of mitotic figures, as I am seeing in this case. This I have pertinently put up for a comparison with hepatocellular carcinoma. For one thing, hepatocellular carcinoma occurs in adults, so there should not be any doubt at all. But compared with these cells, I find that the cells are quite large, polygonal, eosinophilic, and almost resembling the mature hepatocyte. Prominent nucleolus is also seen. So I would like you to compare both these pictures, a macrotrabecular and a trabecular pattern of hepatocellular carcinoma. This is the normal picture of a liver, in which there is a central vein radiating cords of hepatocytes, eosinophilic, polygonal appearance, abundant cytoplasm, which is being reflected in a hepatocellular carcinoma. Whereas in the case of a hepatoplastoma, look at the cells over here. As I told you, basophilic, uniform. Sometimes there can be an acinar or a pseudo-acinar pattern that can be seen. Grossly, the tumor is well circumscribed, soft, fleshy, hemorrhagic, with areas of necrosis. Again, thanks to this particular author for the wonderful contribution. Bile staining will be. So age is supposed to be one of the leading factors in the diagnosis. For evaluation, CT, MRI, chest CT for metastasis, obviously biopsy is mandatory, alpha fetoprotein. These are all important in the diagnosis. The treatment is composed of surgery and neoadjuvant chemotherapy. The differential diagnosis, hepatocellular carcinoma occurs in adults. Hepatic adenoma less than 5 years, or rather more than 5 years. Lymphoma or any of the blastomal tumors, even a nephroblastoma higher, can be mistaken for this. The complications are, it is intraperitoneal, there can be a rupture. Chemotherapy can have its own complications. Post-transplantation is also associated with complications. And the social implications we people know. The prognosis is otherwise good with the modern treatment. We shall glide on to the next slide. Slow growing lesion in the jaw, diagnosis and differential diagnosis. Thank you.